Welcome to Chapter 13, the sensory systems. In this chapter, we're going to review the organs and structures of the eyes and ears and terms related to the eyes and ears, as well as word parts related to the eyes and ears, common medical terminology, and abbreviations and terms related to the eyes and ears. So what are the functions of the eyes? To provide vision in conjunction with the brain, to translate light rays into visual images. And the organs and structures of the eyes, each eye is located in an orbit, and the eyes are protected by the eyelids. As well, the eyes are lubricated by fluids produced by the lacrimal glands. Be sure to understand the anatomy of the structure of the eye, the conjunctiva, the cornea, the iris, the pupil, the lens, the anterior chamber containing the aqueous humor, the posterior chamber containing the vitreous humor, the sclera, the choroid, the retina, the vitreous body, and the optic nerve. The orbit is the bony cavity of the skull that encases the eye. The conjunctiva is the mucous membrane that lines the eyelids and outer surface of the eyeball. The lacrimal glands are your glands that secrete tears. They include the lacrimal ducts, which is the channel that carry tears to the eye, and the nasal lacrimal ducts, and those are the ducts that carry tears from the lacrimal gland to the nose. Here you can see a diagram of the right lacrimal gland and duct, and see the lacrimal gland just above the eye, the tarsal glands, the lacrimal ducts, the lacrimal sac, and the nasolacrimal duct. The outer layer of the eye consists of the sclera, that's the tough outer layer of the eye, the white of the eye that extends from the cornea to the optic nerve. The cornea, which is the transparent outer covering of the anterior portion of the eye. The aqueous humor, that's the watery fluid that fills the anterior chamber of the eye. The iris, which is the colored muscular part of the eye located behind the cornea that allows light to pass through. The middle layer of the eye consists of the pupil, which is the opening in the middle of the iris through which the light passes. The lens, which is the transparent structure behind the pupil that bends and focuses light rays. The choroid, which is the middle layer of the eye that contains blood vessels. The vitreous humor, which is the jelly-like fluid that fills the posterior chamber of the eye. The inner layer of the eye consists of the retina, or the innermost layer of the eye that contains visual receptors, the optic nerve, which is the nerve that carries impulses from the retina to the brain to provide the sense of sight. The fundus, or the posterior portion of the interior of the eyeball, which is visible through the ophthalmoscope. So word parts that you need to be prepared to understand in this section are blepharo, or eyelid, conjunctivo, which is the conjunctiva, corneo for cornea, cryo for cold, dacryo or lacrimo for tears or tear ducts, diplo for double or two, iro or irido for iris, carotid for cornea, oculo or ophthalmo, O for eye, opto for vision or eye, photo for light, presbyo for related to aging, pupillo or choreo for pupil, retino for retina, sclero for hard or sclera, tono for tension or pressure, prefixes by or been for to or twice, suffixes ectasia or ectasis for dilation or stretching, lysis for the destruction, breakdown, or separation, malacia for the softening, meter for an instrument for measuring, metry for a measurement of, opia or opsia for vision, phobia for abnormal fear, aversion to, sensitivity to, ptosis for a prolapse, drooping or sagging, rhea for flow or discharge, spasm for involuntary movement, trophia for to or turn. Some adjectives and other related terms to this system are accommodation, and that's the ability of the eye to adjust focus on near objects, binocular, pertaining to both eyes, blepharal for pertaining to the eyelid, conjunctival pertaining to the conjunctiva, cornea pertaining to the cornea, and intraocular within or inside the eye. Iridal or iridial for pertaining to the iris, lacrimal for pertaining to tears, ocular or ophthalmic for pertaining to the eye, optic pertaining to vision, pupillary for pertaining to the pupil, retinal for pertaining to the retina, and scleral for pertaining to the sclera. Terms related to abnormal vision are amblyopia, which is poor vision. It's usually in one eye, and it's caused by abnormal development of the visual areas, and it's also referred to as lazy eye. Astigmatism, that's the distorted, blurry vision caused by abnormal curvature of the cornea or lens. Color blindness, that's the deficiency in distinguishing some colors. Diplopia is double vision. Hyperopia is farsightedness. Myopia is nearsightedness. Nyctalopia is poor vision in reduced light or at night, and it's commonly called night blindness. Photophobia is an extreme sensitivity to light, and presbyopia is impaired vision caused by old age that usually happens around the 40-ish years. Deviations and corrections of vision. In figure A is hyperopia and B is myopia. So in A, hyperopia is the farsightedness, and that's corrected with a convex lens, and myopia or nearsightedness, that's corrected by a concave lens. Terms related to the conjunctiva is conjunctivitis, which is a highly contagious inflammation of the conjunctiva. It's commonly referred to as pink eye. Ophthalmia, that's a condition of the eye characterized by severe conjunctivitis. Pterygium is a growth of the conjunctival tissue over the cornea, and it's usually associated with prolonged exposure to ultraviolet light. Here you can see pterygium. Conditions of the lenses and retina, cataracts, those are the clouding of the lens of the eye, which causes poor vision. A detached retina, that's the separation of the retina from the choroid in the back of the eye, and it's usually caused by an injury, tumor, or hemorrhage. Diabetic retinopathy, that's a degenerative change of the retina caused by diabetes mellitus, and it usually leads to blindness. And here you can see a cataract. You can see the white part of the eye. Here you see a picture of the detached retina due to a retinal tear and the fluids leaked out. See the vitreous humor. Other conditions of the lens and retina are macular degeneration. That's the deterioration of the macula or the central part of the retina, and that causes impaired central vision, and that's most commonly related to advancing age. Retinitis pigmentosa is a hereditary progressive deterioration of the retina causing nyctalopia and impaired vision. Here you can see the different simulated vision abnormalities. So A is normal vision, B is a cataract or a hazy vision, C is diabetic retinopathy, and so the retinal damage leads to blind spots. D is glaucoma, and that's loss of the peripheral vision, you can see there, and E, macular degeneration, which is the loss of central vision. Some common tests and procedures related to the eye are the extraocular movement, EOM, and that's the movement of the upper eyelids and eyeballs through use of the extraocular muscles, and that's assessed during a clinical examination to screen for eye movement disorders. Fluorescein angiography, that's a visualization and a photographic recording of the flow of an orange fluorescent dye throughout the blood vessels of the eye. Chronometer is an instrument used for measuring the curvature of the cornea. Ophthalmoscope is the instrument used for examining the interior of the eye through the pupil. Pupillometry is the measurement of the pupil. Ophthalmoscope B is the use of an ophthalmoscope to view the interior of the eye. Refraction is the test using a manual refractor to determine an exact vision prescription. Here you can see ophthalmologists using an ophthalmoscope to perform the ophthalmoscopy. Some common tests and procedures are the Snellen chart, that's the chart containing the symbols that's used in the testing of visual acuity. Tonometry, that's the use of a tonometer to measure intraocular pressure within the eye, and that's done to diagnose glaucoma. Visual acuity testing, or VA testing, that's the testing for the sharpness or clarity of distant vision. Usually they use a Snellen chart, and normal visual acuity is 20/20. Visual field testing, or VF testing, is the assessment of the range or area visible to one eye without movement. Here you can see the Snellen chart. You've probably seen that quite often. Common surgeries and procedures related to vision correction are LASIK, and that stands for laser assisted in situ keratomelias, and that's the procedure that uses a laser to correct the corneal flap and reshape the corneal tissue, and it's used to correct vision problems such as myopia, hyperopia, and astigmatism. PRK, photoreactive keratectomy, is the procedure using a laser to reshape the cornea to correct vision. Cataract extraction, that's the surgical removal of a cataract. Cryoretinopexy is the surgical fixation of a detached retina or a retinal tear by using extreme cold freezing to seal the tear. An IOL, which is an intraocular lens implant, and that's the implantation of an artificial lens to replace a defective natural lens. Phacoemulsification is the use of ultrasound to shatter and break up a cataract, and it's followed by aspiration and removal. Retinal photocoagulation is the repair of a retinal detachment or tear by using a laser beam to coagulate the tissues to allow a seal to form. Scleral buckling is the repair of a retinal detachment by attaching a band or a buckle around the sclera to keep the retina from pulling away. Here in this diagram, in diagram A, you see the detached retina, and the arrows show the movement of the fluid. You can see the retinal tear, the retinal detachment, the sclera, and the choroid. And on the right, the B, the scleral buckling, you can see the repaired tear. The buckle holds the sclera against the retina, and the scleral band or buckle that encircles the globe. Common medication and drug therapies, corticosteroid treats the swelling and itching of the eye. A hypotonic relieves dry, irritated eyes. A miotic constricts the pupil. Mydriatic dilates the pupil, and prostaglandin relaxes the muscles in the eye's interior structure to allow better outflow of fluids. An optician fills the prescription for corrective lenses. Optometry is the medical specialty for vision prescription. Optometrist is the person who practices optometry. Ophthalmology is